When it comes to teeth extractions, what does having a dry socket mean? Hi, I'm Dr. Priya Graywal. I am a dentist practicing in the Washington, D.C. area, and today we are talking about alveolar osteitis, or dry socket, including ways to prevent it from happening to you. So what is a dry socket? A dry socket is a painful problem that can happen after a tooth is removed, even after a wisdom tooth is removed. After your tooth is extracted, there is an opening or a hole where the tooth used to be. Normally, a blood clot forms in the hole or the socket to protect the bone and help the area heal. In a dry socket, that clot never forms, or the blood clot loosens too early and the bone and nerve endings get exposed. When that blood clot breaks down too fast, there can also be bacterial contamination of the socket. With that protected layer gone, the exposed bone becomes inflamed and very sensitive. So how common is having a dry socket after wisdom teeth removal? A dry socket is more common after lower wisdom tooth surgery. In routine extractions, it happens about 1 to 5% of cases, but the risk can also vary based on how tough the tooth extraction is to do. So if your wisdom tooth extraction is very difficult or is considered a traumatic extraction, the risk can go up. The risk of having a dry socket is much higher in patients who smoke, are elderly patients, and patients who have a pre-existing gum infection. How can you tell if you have a dry socket? If you have pain that gets worse around day 1 to 3 after your extraction instead of getting better, this is a pretty good indication that the blood clot that should be there is not there, and the socket is left dry or exposed. The pain can even spread to the ear or the jaw or the temple. Many times people also notice a bad taste in their mouth or feel like they've had bad breath for days. It is important to contact your dentist so that they can see if the pain is coming from the dry socket or something else. They'll also look for an infection, which may or may not be there with a dry socket. If you have a fever or facial swelling, this may not be typical of just a simple dry socket and could mean that there is an infection and your dentist needs to treat that soon. How would your dentist treat your dry socket? Treatment of a dry socket is focused on comfort and local care, as it does usually heal itself. Antibiotics are not used unless there is a true infection. Your dentist may put on a medicated dressing called alveolar paste to soothe the area and cover your socket. Pain relievers can also be used as needed, and the dressing may be changed after a day or 2 if the pain does return. With proper care, pain from a dry socket usually improves over a few days. How can you prevent a dry socket from happening? Prevention of dry socket starts with a good surgical technique and careful aftercare. For patients, to prevent this, the big points are: go to someone that is skilled in extracted teeth and has done it before, preferably a surgeon. Do not smoke or vape. And it's important to avoid vigorous rinsing or spitting for the first 24 hours. Also, avoid drinking through straws and follow your dentist's cleaning instructions for that socket. Antimicrobial rinses or gels containing chlorhexidine can also reduce the risk of dry socket in higher risk cases. In fact, there is evidence that shows that a chlorhexidine mouthwash started before or 24 hours after extraction can lower dry socket rates. Your surgeon or your dentist will balance these benefits against the minor side effects of the chlorhexidine, like temporary taste changes or staining from over-rinsing. If your pain becomes severe or suddenly worse 1 to 3 days after wisdom tooth extraction, be sure to call your dentist or your surgeon. Also call them if you develop a fever or you have swelling that is spreading. The faster your dentist can take a look at you, the faster treatment can be started to make you comfortable. I hope you found this helpful. Remember to hit like and subscribe below, and any comments or questions are welcome. I'll see you in the next video.